Tara Winston has had a rough few months since being diagnosed with Hodgkin's lymphoma.
Nights throwing up, completely alone.
But then, after experiencing chest pain, she was stuck next to a COVID-positive patient in an overcrowded emergency department at the Royal Adelaide Hospital.
I'm going through enough and I'm dealing with enough and I'm being told to be careful, but how do I be careful when I can't even be safe in an emergency room?
The hospital says COVID-positive patients and high-priority presentations like Tara Winston would usually be taken to a separate cubicle and not have to wait that long. But the hospital was experiencing peak COVID demand.
To be put into the waiting area with people that are COVID positive and other people around her that could have quite easily compromised her health was a real struggle.
At the beginning of this weekend, there are more patients than hospital beds here in Adelaide. But overwhelmed emergency departments aren't just a problem here. Hospitals across the country are under significant strain. In Queensland, a record 1,061 people are in hospital, 30 in intensive care. In New South Wales, 2,176 people are in hospital, while in Western Australia, 430 beds are occupied by COVID patients, a number that's alarming doctors.
We're going to see reduced access to healthcare. We're going to see more ramping.
Experts are now calling for mask mandates to be reintroduced and for vaccination campaigns to be reinvigorated.
I recognise that people are tired, scared, sick of having to do this, but we have no alternative.
Without government intervention, they have little hope the wave will subside.
If we just carry on doing the same thing we're doing today, well then we can't expect those numbers to come down.
Take-up rates for the third and fourth vaccine shots remain low and state governments have expressed reluctance to reintroduce mask mandates. Evelyn, Leckie, ABC News, Adelaide.